This presentation is on depression during menopause by Tracy Harris, Amy Newsom, and Jenny Swanson. Menopause has traditionally been treated as a strictly medical issue. Negative symptoms have included hot flashes, loss of sexual desire, sleep disturbance, irritability, headaches, and fatigue. However, defining menopause strictly as a biomedical issue can fall short of the mark. It frames it as a disease and perpetuates a paradigm that promotes sexism and ageism. Research has found that menopause has not only biological but also cultural, social, and psychological components as well. Menopause has been linked with higher incidences of mood disorders in middle-aged women. Research shows that women who have never had a mood disorder may be more likely to have the first onset during menopause, and women who have already had a mood disorder before menopause are even more likely to suffer additional reoccurrences during menopause. Depression is one mood disorder that can affect women during menopause. There are several key predictors of those who will suffer from depression during menopause. These can include hormonal fluctuations, vasomotor symptoms, past history of mood disorders, stressful life events, lower socioeconomic levels, and a negative attitude about menopause. Women with one of these factors in their life are more likely to suffer from mood disorders as a result of menopause.
Why is this important? All women who live beyond the age of 50 years and many younger than this will transition through menopause. Historically, women did not survive past this transition. Now, most women will live up to 1/3 of their lives or more after menopause. And with studies that indicate premenopausal women were found to be 2 to 4 times more likely to develop clinical depression, we can see that this is a uniquely vulnerable period for women and that studies on this topic are important. Additionally, education is lacking and there are many misperceptions about menopause. Many women form their ideas about menopause based solely on their own experience of symptoms. Women's beliefs about menopause before they go through menopause significantly affect how they will perceive the experience. One study found that women who had a positive view of menopause before onset experienced less difficulties than women who had a negative view. This finding highlights the role that mental health professionals can serve in the form of education and early intervention. Relevance to minority populations. Cultural differences are widely noted. In one study, African American and Chicana women were found to have a positive view of menopause, while European American women had a more negative view. African American women were more likely to speak about menopause with their female peers, while Caucasian women tended not to speak about it. Although these findings may at first sound positive for minorities, a closer examination reveals the darker truth. The positive attitudes expressed by African American and Chicana women may be a coping mechanism because they have a deep mistrust of white doctors. They have experienced generations of discrimination and have had less access to health care than other corresponding white counterparts. Therefore, they turn to their own social groups to discuss issues related to menopause. Unfortunately, reliance on personal social groups may also result in a great deal of misinformation. Medical and mental health professionals can counter this by providing care that minority women can trust. It also highlights the importance of multicultural training for counselors.
Mental health professionals have an important role to play in helping women avoid the negative effects of the menopause transition. This includes an integrated approach to education, taking into account the biomedical, cultural, and psychosocial factors. Timing of this education is key. Some of the negative experience of menopause can be mitigated with information, so getting this to women before the onset of perimenopause is best. With early intervention, many lifestyle changes can be implemented before symptoms become severe: exercise, diet, social network, and counseling. Cognitive behavioral group therapy has been shown as an effective counseling method for women in the menopause transition. Counselors in community health clinics, local agencies, and medical facilities have interaction with women and the opportunity to bring both education and treatment to these women at the right time to encourage them in this life stage. Menopause is a normal stage in the development of women, and there is much work to be done to help women understand and navigate this life transition well, avoiding depression and other debilitating symptoms. Menopause must become an earlier topic of conversation for women with doctors, counselors, and other healthcare workers. Pharmaceutical solutions must be paired with other strategies for best results. Work must be done to ensure all women, including minorities, have accessible care available to them. More research needs to be done into what counseling approaches work best for women in menopause, particularly those suffering from mood disorders such as depression. Counselors must be trained in a holistic approach to women, including education as well as counseling solutions. Our cultural obsession with youth must be challenged, and women must be encouraged to see aging in a positive light. With better education and treatment, women can begin to see menopause as a transition to a new and fulfilling stage of life.